Assalamu alaikum dear students. In this video I will tell you about the investigations that we do in case of amenorrhea. Amenorrhea is the failure of the start of the menstruation in case of primary amenorrhea, or the absence of the menstruation for more than 6 months in the absence of pregnancy in a woman of reproductively active woman. So to confirm the cause of the amenorrhea, different investigation we have to do. Number one is the blood test. In blood test we come to know about the hormonal status, hormonal profiles, or the status in the blood. For this we should know, is there LH, luteinizing hormone present, follicle stimulating hormone present, testosterone present. So if there is the luteinizing hormone and the testosterone present in the blood, we have to say that there is polycystic ovarian syndrome. As I have told you, the polycystic ovarian syndrome occurs when there is the problem with the ovary. From ovary there is release of estrogen and progesterone, and from pituitary there is release of FSH and luteinizing hormone, and pituitary hormones activate the ovary to release out the estrogen and progesterone. In case of polycystic ovarian syndrome, there is problem with the ovary, so it cannot release out the estrogen and progesterone, but pituitary is intact, so FSH and luteinizing hormone are continuously released by the pituitary, and these ultimately come into the blood. So if there is presence of luteinizing hormone and the testosterone, we say that there is polycystic ovarian syndrome. And if there is FSH is present, so we say that there is premature ovarian failure. The premature ovarian failure is that when there is FSH is present, but due to the problem with the ovarian cells, there is no release of estrogen, so estrogen is down. So if the FSH is increased due to the activation of the pituitary that continuously release out, and decreased estrogen from the ovarian cells, so the combination of these things, we say that there is hypergonadotrophic and hypogonadism and hypogonadotrophic. So these, and then prolactin. Number 2 main test is prolactin. If there is increase in the prolactin, there may be the cause of prolactinoma, tumor of the pituitary gland. So in case of tumor of the pituitary gland, there is increased stimulation of the prolactin, and this ultimately cause prolactinoma, the cause of amenorrhea. Third one is ultrasonography. Describe about the polycystic ovarian syndrome. In ultrasonography, in case of polycystic ovarian syndrome, we see that 8 or more than 8 subcapsular follicular cysts are present. Number 4 one is MRI. In case of pituitary adenoma, or the transverse vaginal septum. So in pituitary adenoma and transverse vaginal septum, we do MRI to confirm the diagnosis. And next one is the hysteroscopy. We see the with the stethoscope we see the visualize the vaginal tract. And then number last one is the karyotyping. We also can do to confirm the amenorrhea if there is a Y chromosome present, Y chromosome then to rule out the Turner syndrome. So these are the investigating strategies to find out the cause of amenorrhea.